It's Tom Calton talking about hip replacement surgery. So we began using the anterior approach about 2007 in the fall. And one of the problems, and Sharon is a good example of the problems we ran into. The stem we were using, awesome stem, one of the world's most successful stems, and it was one of the first to be used in the anterior approach in the US. But this stem didn't have good stepping. And stepping is when you shift gears and it goes first, second, third, fourth, fifth, very symmetrically. Bad stepping would be it went first, second, third, sixth. Well, two, when we prepared the stem, we use what are called rasps. And these rasps have sharp cutting flutes. And that prepares the shape of the inside of the femur to receive the implant. Well, the previous implant, the rasps were a little bit too small, so as the implant went in, you potentially risked cracking the femoral component or the femur.
So Tom told me, I'm like a history. This is the one 12 years ago.
Okay.
This is one he just put in.
Awesome.
You see the wire?
Sharon, unfortunately, had a crack. Now, this didn't happen often, but it wasn't rare either. And of all the hips that had a small crack, we'd put a wire through them and the patient would be treated normally. And that went away and wasn't a big problem. But that was the second big issue that we dealt with when we designed the new stem. The new stem, the stepping was improved and the rasping was improved so that it matches exactly. And if you look on this implant, we're able to see the collar sits nice and flush right on the calcar. That is some of the strongest bone in the human skeleton. And the rasping is such that when the implant goes in, it just goes in with a feel and even a sound change when the implant is fully seated, and it's just money. And that's why these stems do not loosen. We don't see cracks in the femur anymore. It's just been a beautiful stem. And Sharon's had one of each, and she's doing beautiful.